Self-Feeding for Infants and Toddlers, Cultivating Independence in the Feeding Process, presented by Michelle Murray. Baby-led weaning is an approach to self-feeding that allows caregivers to follow the infant's developmental readiness and interest in starting solids. In this approach, the baby will set the pace for eating and the quantity of their intake. The baby-led weaning approach was conceived in 2005 by PhD in public health nurse Jill Rapley. The concept quickly spread international attention as an ideal alternative to infant feeding that offers many benefits. Parents consider their weaning options once their baby begins the transition from milk to solid foods. Whether the preferred method involves textured purees, baby-led weaning, or a hybrid approach, food during the first year is supplemental to breast milk or formula, which provides their essential nutrition. So the transition allows time for the infant to practice eating skills for the actual time of weaning, which is around 12 months old. Of course, as the infant becomes more accustomed to eating food and their interest peaks, some babies naturally start to self-wean from milk and consume more food in the later stages of the process. Until the baby-led weaning movement hit the market, parents and caregivers typically started solid foods as purees. Whether homemade or purchased commercially, purees are offered in stages as a slow approach to textured foods. Traditionally, purees were spoon-fed to the infant by the caregiver in an adult-led manner. To encourage independence with self-feeding, it is recommended that infants are engaged and involved in the process of eating. By doing this with purees, the caregiver acts as a guide to assist the infant with spooning. When feeding, infants are encouraged to use their hands and fingers for open exploration and are handed the spoon to bring to their mouth independently. Some pediatricians recommend introducing solids and allergens earlier than 6 months of age. Introducing purees is a good option in such scenarios if the infant has not yet met the physical readiness milestones for finger foods, such as sitting upright independently. Once the child is ready, the baby-led weaning approach offers benefits including less preparation. The foods offered to the infant are modified foods prepared for the rest of the family, so there is no need to process homemade purees. The infant is introduced to the same food and flavors the family eats and becomes accustomed to them at an early age. The infant gains motor skills by reaching, grasping, and bringing food to their mouth. The bite reflex for chewing is exercised during the appropriate sensitive period between 6 and 9 months. Learning to chew before the reflex integrates between 9 and 12 months is ideal. Having control of the activity of eating empowers infants with confidence and lets them eat intuitively from an early age. Key milestones for readiness for solids are sitting with minimal support, upright head control while seated for the duration of a meal, the ability to reach and grasp objects while seated and bring them to the mouth, and displayed interest by intently watching others eat, mouthing for food, or leaning forward toward the food. The optimal seating position for safe eating is upright in a sturdy seat with a 90-degree angle at the hip, knee, and ankle. Creating a good support base throughout the body significantly benefits oral motor skill development and promotes success. Choosing the right size and type of utensil and cup promotes safe, efficient, independent eating and drinking development. Before you begin, check your expectations of what will happen and allow your baby to take the lead. Start with one new food a day or every few days. Vary the textures of foods you offer and start exposing your baby to varieties right from the start. According to speech and language pathologist Brittany Medeiros, independent eating is an important activity of daily living that is encouraged in many cultures. It allows children to develop self-worth, pride, motor skills, and social-emotional growth. There are also safety concerns that can be lessened when a child is able to feed themselves. With self-feeding, a child can make different food selections and set the pace and quantity of eating. Whichever method you choose to start solids, both baby-led weaning and purees are perfectly acceptable ways to introduce a baby to solid foods. Parents may feel pressure to do it the right way. You can do it one way or the other or combine the two to make it work for your family. The goal is for infants to be introduced to flavors, nutrients, and foods they can easily eat and explore freely and safely. It should be an enjoyable milestone for all involved. Thank you for listening. Contact Michelle Murray at mmurray@alcuin.org with any questions.